Hi, my name is Anku Goel. In my podcast today, I have tried to find more information and awareness on how to combat the biggest outbreak in the world today. What is COVID-19? How far has it reached? And most important, how much is India prepared with the antivirus and antibiotics to treat the patients? At this point, when WHO has declared it as pandemic, US and other countries have called out for health emergency, it is pertinent to first understand our situation and how to deal with the symptoms of COVID-19. To talk in details, I have the Managing Director and Chairperson of Biocon Ltd, Kiran Majumdar Shaw. She tells us about the precaution that should be taken immediately to contain the spread of coronavirus in the country and how government should take some steps to prepare and further stock the medicines for the emergency. So thank you so much for sparing time to speak to our listeners here. It is a complete fear in the market right now. Panic has swept around, not just in the Dalal Street, but across, not knowing what to understand from the coronavirus. Can you help know what exactly is the understanding from this whole pandemic situation being announced by WHO?
Well, I think there is a global frenzy in terms of the coronavirus because I think governments are trying to understand how they should cope with the spread of coronavirus. I think you have seen many national leaders talk about the spread of coronavirus and what they anticipate in terms of the percentage of their populations that they expect to get infected. So I think this is what is causing the scare because, the announcements of lockdowns of countries, quarantines, I think the US banning all the flights from Europe, all this is creating a lot of pandemonium and concern. And of course, huge alarm bells ringing everywhere because I think they feel that we really don't know how to cope with this particular crisis. And actually, we have to now sit back and see what is COVID-19 all about. I think if you look at the data, it clearly shows that it's 20% of the infected population that really are at any risk. 80% of the population will get a mild version of COVID-19, which of course is about fever and cough and, that kind of a situation. It's the 20% that I think everybody is worried about. And of that 20%, I think there is a certain percentage of elderly people who are at grave risk. And so because the fatality level is at 4%, I think people are very worried about what impact it will have on, the healthcare in the country and, what impact it would have on people's fears. And I think that's what is really causing this huge panic across the world. Moreover, I think the biggest concern is that if 20% of the infected people need hospitalization, I think every country is trying to deal with this challenge of seeing do they have enough hospital beds to deal with these patients, okay? Secondly, as you know, these patients can infect other hospital patients, which is very scary.
Right.
And therefore, they are trying to see where they can create these isolation wards if required. Here we are even thinking of creating nursing homes dedicated for such coronavirus cases. I think that's really where the panic is, that people don't know how to deal with this epidemic.
Even talking of quarantine, the governments have quite suggested now across globe that we will rather go for a home quarantine or self-quarantine mechanism because the infrastructure is not at place or not that quick to make a so-called arrangement for people to have the isolation outside their own houses.
Well, I think, self-quarantine is a safety precaution. I think we in our own organization have told all our employees who have been overseas and who've come back in the last week to basically impose a self-quarantine on themselves and don't come to work for 2 weeks, even, not that any one of them is showing a symptom. I think, organizations like us have already rolled out a COVID-19 preparedness plan, and one of them is a self-quarantine for all our employees who have returned from an overseas visit.
Ma'am, when talking about the medicine and the pharma aspect of it, how well is India prepared? Because we know we have been quite API dependent, the basic ingredient formulation, intermediary, and we have been dependent on China for the longest time. How do you see us stand when it comes to preparedness with the medicines that are required to deal with such kind of unexpected pandemic situation that has come by?
I think, most governments have not been responsible enough in terms of stockpiling these kind of medicines in the event of these kind of pandemics, okay? I think they sort of keep very low levels of inventory, and I think this has to be re-looked at in terms of being prepared for such epidemics. Now, the problem is also that the government puts a ban on exports, ban on, even ban on retail selling, but then they themselves don't pick up these stocks. So that is the big, injustice that the industry is suffering from. I know that last time when we had this whole, this swine flu epidemic, I remember many of the pharmaceutical companies were told that they should not offer anything into the retail market and they can only supply to the government. But I know that all these companies complained that the government never picked up their stock and they were left with huge inventories because government said we will only pick up as and when we need it. Now, this is not fair to business, right? I think it's extremely important. Even now, if you say I'm going to ban export, where are you guaranteeing that whatever they are not selling overseas is going to be picked up domestically? Is the government is underwriting the stock? Is government going to pick up all the stock? So, I think these are the things where we need to make sure that we don't have these knee-jerk reactions which really don't really help industries which are trying to do their best. So I think this is where I think we have a problem saying that industry is willing to do whatever it can. I know for a fact that many of the essential drugs today that are required to at least deal with the COVID-19 virus is inadequate, has adequate supply from Indian industry. But of course, it all depends on what the extent of this epidemic is going to be in India. At the moment, the numbers are very low. So at these low numbers, obviously, there's enough inventory to deal with it. But for any reason, if it suddenly balloons into a large number, you can never predict whether we have enough supplies or not.
So at present, if the numbers tell us it must be nearly to serve at least a lakh of patients, but what if it crosses the number that we are not expecting? How do you think we are ready or we should be dealing with it at this point? Can industries come together?
How can you do it? I mean, there is a limitation in terms of how much you can manufacture. We are dependent on China, right? Now, obviously, most companies have kept about 6 to 9 months stock. Okay, so they have 6 to 9 months inventory. And so it will cover a very large population if you need to treat such a large population. But we don't have any idea about how many patients are we really going to deal with in the near future. Supposing we are lucky enough to show that we contain this epidemic, which I hope we do, and that we don't have such large numbers, okay, we are okay. But suddenly if we have something like an Italy-like situation where they were totally unprepared, okay, then we have a huge problem. So I think that's where we should not start forecasting and speculating or making loose statements, because that is a big worry. Because I think media must be also very responsible to make sure that people know that there is adequate supply of these medicines as long as the numbers are controlled. So I think these are the kind of measures that we need to take. Right now there is panic buying, panic selling. There's a lot of wrong things also happening.
Yes.
I just saw a video on how masks are being recycled and sold and all kinds of things. That's terrible. So I think people have to stop panicking. The Ministry of Health in India has been very responsible. I think they've taken very immediate measures into dealing with the crisis. They have actually done whatever they could in a very short time. To take certain measures, making sure that schools are shut down, in making sure that all companies are told that please minimize travel, please do not have large gatherings. So I think they've done their bit. How many people are, US today is going through a huge crisis because they can't even test most of their patients who are calling in, right? They don't have enough screening centers. I think we should be more prepared in that sense, because right now the National Institute of Virology is the only one that is really dealing with all these diagnostics. But we should be more prepared. Like supposing suddenly it's an epidemic, are we prepared? Private sector is very willing to come and hold hands with the government. We ourselves, for instance, have a very a very sophisticated laboratory set up in one of our companies, where we are doing routine tests for every company in the world. And this lab is capable of providing, a lot of support to government testing. There are many other such labs. Private players have told the government, please, we are all here to help you. Government has to start taking advantage of these offers of help. So far, we haven't seen a response from the government. But I think government must, expand their testing centers to the private sector, because they need more capacity. And that is the state of preparedness we're talking about. It's not about just doing the things, for an immediate problem. It is about a sense of preparedness for an eventuality. So you might never have to do it, but if you're at least prepared, then you don't have that last minute panic.
One more question has been that we have been API dependent. We are trying to work that up. Yeah. So one more question that has been of concern is a key raw material requirement or ingredients in India have also been a concern where government has not looked into for time now. It is high time, other than just talking of API, we look at the basic ingredient raw material required to make these intermediaries.
Anku, let me answer that question by saying this is not the first time we've had an epidemic. We've had similar epidemics of many times before. And each time we ask the same question. Don't you think we should have less dependence on China? Don't you think Indian companies should be doing X, Y, and Z? But it's not happening. Why? Because the government is not even enabling it or even supporting this kind of investment. Today, everything is about price control. Nobody is going to make these products if you make them unviable. So I think the government needs to sit down with industry, use this at a time as a opportunity for us to strengthen all our capabilities. We can do everything. We can make every single intermediate that we need. We can make every single API that we need. We can make all the antibiotics that we are importing from China.
90% dependency.
But the point is, it has to be viable. You cannot say, okay, you go and make it, but we are not going to help you at all. It's up to you to make it. It doesn't work. I think government has to understand that today is a global crisis where India actually could have been a very, very important factor in allaying many of these fears, because the whole world is only dependent on China for antibiotics, right? And the world, of course, is dependent on India and China for many of the generic medicines. But India itself is again dependent on China for many of the starting raw materials. So there is this sort of problem where China then figures as the most important player in this particular ecosystem, in this supply chain. So we have to make sure that India actually is as strong as China is in terms of being a supplier for global health. And that is why I think the government should understand that the Indian pharmaceutical sector, which is often called the pharmacy of the world, has to be supported in a very big way. This is a very small sector right now, according to me. It is a $40 billion sector. It should be a minimum $100 billion sector. But it is not happening because the investments are not going in. Government is not encouraging this sector. They are talking about stopping the 150% weighted tax deduction on R&D. That is a very foolish thing to do, because this is an R&D led business, and this is a gestational R&D led business. So you have to invest now and recoup the profits later. Problem is that when you develop generics, you have to first do R&D to develop that generic, okay? And it takes you almost 3 years to develop every generic. And after you develop the generic, then basically you have to wait for another few years before you can export it or market it, right? So your return on that R&D that you have done is going to be after 5 years. So government should understand that 150% weighted tax reduction you're giving on R&D is not a big favor. You're it's an integral part of that business. If you want to help to expand the sector, you have to support that. You cannot withdraw that provision.
And then the Indian players can't be questioned of not innovating new drugs and depending on this.
Unfortunately, all the ministries that are involved in coming up with fiscal incentives don't understand the needs of the industry well enough. They look at it in other sectors and they generalize it. Why is it that you're giving so many incentives to the IT sector? IT sector does not do R&D. It only offers services. So they are getting all the incentives. And a sector like the pharmaceutical sector, which is so R&D dependent, hardly gets any incentive. Even today, the manufacturing 15% corporate tax is only being extended to greenfield projects. Why not brownfield? You want to expand, existing capacity, right? If you want to actually set up fermentation facilities within an existing unit, why not do it under that unit and give the same 15% manufacturing incentive, right? But why do they have to set up a new unit in summer, and claim it that way? So I'm just saying this kind of myopic thinking has to go away.
This is high time that the change in the perspective of the government to deal with the pharma space and the health industry has to take place.
Not only is it a big opportunity in terms of, the economy and, the manufacturing economy, but it is also a big employment generator.
One last question. There has been a crackdown on the market because now the fear is of coronavirus, which has taken over the Dalal sheet completely. It's gone beyond expectation. There is overreaction in the market. Do you have a say on how it should be dealt at this point? Should it be a passing off phase? Is it a temporary shift that will come back into normalcy over some time if the precautions are taken care of as you have suggested?
Look, first and foremost, Dalal Street is reacting also because of global reactions, okay? It is not isolated. So Dalal Street has to react the way other markets are reacting. And the world is reacting because they know that the coronavirus, which is a tiny microscopic, entity, has brought almost the entire world to a grinding halt. And the fact is, it is going to have a huge impact on the global economy. They're already talking about getting into recession if the coronavirus problem is not sorted out in a month's time. So you have seen the whole travel industry is affected. The tourism industry is affected. Everything that you can think of is being impacted by the coronavirus. So Dalal Street has to be worried, and there's no easy answer to how to appease and calm the markets, because markets know that every sector is affected. Right?
How much time could we expect it to take?
Nobody can guess it. If everything is under control and if everything look, China has actually done a tremendous job.
Great.
China and Korea have already brought it under control, right? And China is already limping back to normalcy. So if you can actually take a cue from China and Korea, then maybe this will not be such an extended crisis. Italy, Europe is all now in a crisis mode because Italy took a long time to react to coronavirus, and they are the culprits who have spread the coronavirus to Europe and to other parts of the world. US also has been slow to react to the coronavirus, and now they have this huge reaction where they've banned travel from Europe and what have you. Now, that's all going to impact the economy in a huge way. Deals with it the way everyone deals with it and contains it. And when you start seeing numbers of coronavirus cases coming down, and especially if you start seeing that, there are very few fatalities in any part of the, in any of the infected populations, then the fears will start receding. Until then, you're not going to be able to allay these fears. And I think everyone is worried that it's going to have such a big impact on the global economy that they're actually fearing recession.
So thank you so much for spending that time with us and sharing your views with the listeners.
Thank you.
Well, the relief sign at this point, as mentioned by Kiran Majumdar Shaw, is that India is prepared to deal with the COVID-19 for at least 6 to 9 months. We have adequate medicines to treat the patients, but will we be able to contain the spread within time is the larger and the only question now. Government has taken prompt action till now with lockdown in the city, especially avoiding public gatherings savings, but what needs to be learned is how India, being one of the most important countries to serve in the pharma space, is yet dependent on China itself for basic raw materials. Kiran Majumdar Shaw gives us enough precautionary guidelines and also cautions on not to panic but focus on containment. The reaction on Dalal Street is much catalyzed by the COVID-19 spread, but has other global economic factors still being the foundation for the crackdown in the market. We'll try to bring more updates on markets and industry in the next episode. Keep listening.